This is Damian McNamara with Skin Analogy News Digital Network. Cryolipolysis is the destruction of fat cells through precise, controlled cooling. And what will happen is a lot of patients will come into a dermatologist's office and say, does this actually work? And with me is Dr. Elizabeth Tanzi, who is in private practice in Washington, D.C., to help me answer that question.
Well, cryolipolysis is based on what we as dermatologists know about fat cells from cold paniculitis, or so-called popsicle paniculitis, in that there is an inherent vulnerability of adipocytes, fat cells, to prolonged cold exposure. So that's the mechanism of action here. Prolonged cold exposure stimulates the death trigger, apoptosis, and then after 2 to 3 months we see inflammation and a destruction of the adipocytes. So it does work. It's based on something we've known for many, many years in dermatology.
What are some of the common misperceptions that patients have about cryolipolysis?
The number one misperception is that we're actually freezing fat away. I know a lot of the media picks up on the freezing of fat, but we're not freezing anything here. We're doing a precise, controlled cooling of the tissue, and it's the fat cells that trigger the apoptotic changes, and they're the ones that get destroyed over time. All the other surrounding tissue remains intact.
What factors are important when it comes to patient selection?
Patient selection is paramount to success with the cool sculpting procedure, because it's really meant for discrete bulges of fat that are typically somewhat resistant to diet and exercise. It's those discrete bulges that we can target, stimulate apoptosis, and flatten. This is not a weight loss technology. It's not for large volume reduction of fat. That's where we'll bring in liposuction if need be. This is for those specific areas that we want to contour. So that's where patient selection comes into play, because if you're not choosing those patients that have the bulges, if you're choosing obese patients or patients who say have a unrealistic expectation of their overall result, you're going to be set up for failure with the procedure.
And what do you see in the near future and the far off future with this technology as it develops?
Well, with cryolipolysis and indeed all the non-invasive fat removal devices, we are in the infancy of what we know about these technologies, how we can best treat with these technologies. There are changes that are taking place with the devices themselves to make it more applicable to other areas of the body, not just the love handles and the abdomen, but soon we'll be able to treat other areas such as arms and thighs to really get a nice contour improvement there as well.
This has been Damian McNamara for Skin Analogy News Digital Network, reporting in Chicago at the American Society for Dermatologic Surgery joint meeting along with the American Society of Cosmetic Dermatology and Aesthetic Surgery.